Good evening. Welcome to our clinic. If I read my email correctly, you were sent to us by your home doctor. Is that correct? Okay, I see. So he advised you to have a cranial nerve exam, but more in particular, the smell test. Is that correct? Okay, so that is exactly what we're going to do for you today. I have lots of different smells here in bottles and containers. I have a couple of spray bottles as well. Some of them are fluids, others are powders. I have some gels for you to smell. And most of them are pretty common smells. A couple of them are a little more challenging, but I'm sure you'll manage. You don't have to have each smell correct. That is not really the point. I just want you to be honest and try to recognize whatever I present you. And if you do not recognize a certain smell, you can just say so. Okay? Perfect. Okay. Now, first things first, I will need to take down some personal information, if that's okay. Right. Okay, so can you give me your full name, please? Okay. How about your current address? Okay. And your phone number? Okay, that will do for now. So, let me explain very briefly how we're going to start this smell test. I need you to close your eyes the entire test, for obvious reasons, of course. Although a lot of the products that I have here are sort of, in disguise, shall we say, I still would like you to close your eyes. Now we're going to start off pretty easy with some very common smells. I will save the more challenging smells for later. Okay? Alright, perfect. Now, what I need you to do first of all, for the first series of smells, is to close your left nostril, please. Perfect. Okay. So here comes the first one. So have a deep sniff, and when you made up your mind, you can tell me what you think it is. So what's that? Coffee. Very good. See, I told you we were going to start off pretty easy. Okay, so next one is in this little bottle. Okay, have a sniff. What do you think that is? Lemon. Yes, very good. Right, next one. Now be careful, this is quite a strong smell. Don't sniff too hard. That is pepper, yes. Okay, so the next one. Okay. That is mint, yes. Yes, it is. Very good. Right. Here's the next one. Right. Do you recognize that? Garlic, yes. Keeps the vampires away, of course. Very good. Now something really nice for you. It's all right, you can smell. Do you recognize that smell? Vanilla. Yes. Vanilla. One of the sweetest smells around. Don't you agree? Yeah. Right, I think it's time to change nostrils, so I would like for you to close your right nostril now. Okay, perfect. And here comes the next one. Have a deep sniff. Okay. So what is that? Suntan lotion. Yes, very good. See, I told you this was going to be a piece of cake. Suntan lotion. Good. Now the next one. It's in this little container here. Let me just open that for you. Okay. And smell. It is a flower, yes. Would you have any idea what flower it is? I'll have you smell it again. Oh, I'm sure you know it. No? Okay, well, you were correct, assuming that it was a flower. It's actually lavender. Yes, lavender. Good old lavender. Okay, so that doesn't matter. You knew it was a flower. You just didn't know which flower. That's quite all right. Right. Next one is in this little packet, which I'm going to open for you. Okay. So, have a smell. It is a bit suntanny, yes. Soap. Yes, of course, soap. Right, so next one is quite a strong smell. I'd advise you to sniff this one quite carefully. Yes. It is a salty kind of smell, yes. Yeah, soy sauce. Very good. You're doing perfect. Right, next one is also in a little packet. Okay, here we go. Yes, tobacco. Very good. You're doing excellent. Okay, next one is in this little box. Have a little smell. Coconut. Yes, very good. Okay, I think it's time for you to open both nostrils so you can use both nostrils to smell now. Okay? Yes, what a sense of freedom. Okay, so I'm gonna use a couple of spray bottles now and a couple of Q-tips because the next 2 or 3 smells are quite strong. So I don't want, I'm gonna spray it on this cotton tip here. Okay, so let me spray first and then you can smell. Okay. Yes, take a sniff, please. Right. What is that? It is vinegar. Yes, of course, vinegar. Next one. I'm gonna use a different Q-tip now for you. Okay, here we go. Yes. Yes, bleach. Exactly. Bleach makes you think of a swimming pool, doesn't it? I saw you thinking that. Okay. Now, next one. I'm gonna stop using the spray bottle now. I think you'll be able to handle this one. All right. Very salty again, yes. Well, that's close enough. It was actually fish oil. Yes. Right. So, next one. Okay, go right ahead. You're not quite sure? Would you like to smell again? Okay, here we go. One more time. Have a good sniff of that. It does belong in the kitchen, yes. But what is it? No, that's not it. One more try. Okay. You don't know? Well, that's quite all right, you know. It's actually rosemary. Yeah. Rosemary. Right, next one. Right. Chocolate, yes. Everybody knows the smell of chocolate. Right. Next one. Go right ahead. So what was that? Cinnamon, yes. Very good. Cinnamon. Okay. Next one is in this little bottle, which I'm going to open right now. Right. Have a smell. That is ginger. Correct. Very good. Ginger. Right. My favorite. Right. Yes. Musk. Yes. Perfect. Very good. Okay. Next one is a gel. It doesn't normally come in a gel, but let's try it anyway. So what is that? Makes you think of a flower again? Well, you're very close. Rose water, yes. next one is quite strong. I would advise you to smell this one very carefully. Okay. Yes, perfect. Fuel. Yeah. Fuel. A lot of people like that smell. I like that smell. Fuel. Okay. Now, I only have a couple of smells left for you. So let's take this one. Okay. You don't quite know? Want to have a second try? Okay. Yes. You can think about it. Still thinking? Listen, I'll give you another try, and maybe you'll know then. Orange, yes. Okay, I think we're done here. You generally, overall, you performed pretty well. So I will send an email to your doctor, and I will give him a detailed report of your results. But I can already tell you now that you don't really have anything to worry about. I think your sense of smell is actually top notch. Okay? Well, thank you for coming, and have a good day. Bye.